All right. Well, here today with Dr. Ben Wilks. Ben, you are correct me if I'm wrong, practicing ER doctor and
That's
part of the
correct.
Onus ownership leadership team, which I believe you guys have, what, 6 locations?
Yep, soon to be
And
seven.
soon, first franchisee coming soon.
That's right.
So obviously you guys are busy, and I think you being able to take some time out of your busy schedule and for us to chat speaks to a little bit about the onus model, and we'll get into that later. But if you could start out sort of filling in, I mentioned your ER doctor, but what does that mean? And what fill everybody's going to listen to this on what you do.
So, as an ER physician, we call ourselves jack of all trades, but master of none. My job is pretty much to manage anything that comes through those sliding glass doors in an emergency room. And it could be anything from, somebody wanting a COVID test because they got the sniffles and a little bit of a sore throat to, full blown cardiac arrest or gunshot wound to the chest. And so it's a job in which you really do have to think on your feet. There's a lot of action, can be stressful at times, as you can imagine, just given the amount of volume that comes through the ER on a daily basis. But I really gravitated towards it because I like action. I'm a bit of an adrenaline junkie of sorts. And I like having a skill set that basically says, no matter what's coming through those doors, we got you. And I really appreciate the team-oriented approach to emergency medicine, right? Because it's not just me. I wouldn't be able to do my job without the rock star nurses and techs that basically that I work alongside. And it's really this team-oriented approach in managing patients. It's shift work, meaning I work a shift and I don't have call. So at the end of my shift, there's still patients that need to be seen, but I get to go home, which is one of the big appeals to that field as well, because I never liked the idea of getting called into the hospital at 3 o'clock in the morning to see a patient. And there's nights and weekends and holidays that sometimes we have to work because it is a 24/7 kind of business, but it's definitely the field in medicine that appealed to me the most.
And how long have you been in this sort of the position you're in now?
So as an ER doc, I finished residency in 2014. So I guess as an attending emergency physician, I've been at it about 10 plus years now.
And does it feel like 10 plus years?
It's getting there. I do now what's called locum tenens, where I basically travel as a freelance independent contractor ER doctor, which as a result of how I structure my work as a traveler, I have a lot more autonomy in picking when and where I want to work, which ultimately allows me to work fewer shifts and have less potential for burnout. So if you were to talk to a lot of ER docs, I would say the majority nowadays are not thrilled with their job. There's a lot of burnout in this field, but I think by virtue of how I've structured it, I still really love what I do.
Nice, nice. And how did how did you and then part of the other Christy and Chad is also part of the Onus leadership ownership group. How did Onus come about?
Well, it was somewhat serendipitous for me as far as my involvement. Christy and Chaz had already had this discussion of wanting to start this company, and we're looking for a medical director. And so when I moved back to the Denver area in 2014 after completing residency, I was approached basically by a friend of theirs, mutual friend, who said, "Hey, I've got some friends who are interested in starting this IV business. Would you have any interest in having a chat with them?" And so we all got together and had dinner 10 years ago now, and just completely hit it off as far as people, let alone me being interested in getting involved with the company. I just really loved who they were as humans. They just were very genuine, very positive people. We had a lot of similarities and commonalities in our love for the outdoors, specifically mountain biking and skiing and all these things that Colorado has a natural playground that offers out here. We definitely resonated on those. And I had thought about this actually during even medical school. I had heard about this concept of these IV hydration companies. Specifically, the first of its kind, as far as I'm aware, was Hangover Heaven, which was started in Las Vegas by an anesthesiologist who was basically going around and treating people who had overindulged in the Vegas atmosphere, as people tend to do. But I thought it was a really cool concept to bring to Colorado, specifically because it's very much a work hard, play hard environment here. People are very active, as you're probably aware. It's a very fit state overall. If you actually look at the obesity map, Colorado prides itself in being one of the only states that actually has overall, generally speaking, like very limited obesity rates when compared to the rest of the population. So there is a culture here about people being very eager to exercise outdoors, but there's also a lot of, music scene, and there's a lot of other things going on where people are just go, go, go all the time. And I think it's a perfect environment to bring IV hydration to enhance recovery, in all aspects of things, whether it's, overindulgence and partying, sure, but also recovery from athletic events, preventing altitude illness, preventing disease by, immune boosting, preventing illness, that kind of thing. So when I was approached at the opportunity to serve as medical director, I just jumped at the idea. And it's been quite an evolution over the last 10 years.
And evolution, I want to touch on that later of the evolution of Onus, right?
Sure.
Onus IV to now Onus IV and longevity. But I think I want to go over, because this was new to me too, and I'm still feel like I'm learning a lot since we've all been working together. Is why do an IV? Why, if I'm somebody, off the street and I see that, why would I look at go? I know, and there's different ones, and I want, if you can get some of those, and you and I've talked, there's the vitamin ones, obviously the hangover one, which is well known, but there's also, and I don't know, I'll probably misspeak a little bit, the NAD one as well. And so if you just touch on like, why is somebody like the general public, why would they look at that and go, maybe I should look into this for performance, recovery, immunity? What's the special formula that IV does that a supplement, maybe a pill or something else I could do?
Yeah, I think the biggest point there is, yes, you can take over-the-counter vitamins and supplements, but it all comes down to this concept of bioavailability. And so when you take something by mouth, you will absorb some of it, but majority is actually going to get excreted as waste. It has to be absorbed through the GI tract. It has to be sent to the liver for processing and metabolizing. And then ultimately your body's going to absorb potentially what it needs. And it's going to be limited. And so it may need more than what you can actually put in. For instance, when it comes to vitamin C, if you were to take, we do offer high dose vitamin C, and we're talking upwards of sometimes 50,000 milligrams, which is a very heavy dose. And I can get into the kind of science behind why someone would want to take those kinds of doses. But if you tried to take 50 grams, 50,000 milligrams of vitamin C by mouth, you'd be in a world of hurt. It would cause horrible diarrhea and probably nausea, vomiting, and stomach cramping. And I don't think you would, you'd probably feel so hot. But when you take it intravenously, it goes directly into the bloodstream, right? So immediately 100% bioavailable. Everything that you, that we would administer in the form of an infusion gets into the system. So that's one of the main reasons why you would want to get an IV over an oral supplement, for instance. I think the other thing, as far as overall, why would you want to do this? It's just a much more effective means of rehydration versus recovery from athletic endeavor. If you're overall profoundly fatigued, you're going to feel a lot better faster. So I think there's just a lot of different reasons depending on the indication for why someone would want to get an IV. For instance, if someone's feeling a little run down and fatigued, that would be a great reason, because we have certain treatments specifically for that. If someone is potentially knowing they've got a very stressful week coming up with lots of travel and probably lack of sleep, and are probably taking somewhat of a hit as far as their immune system is concerned, well, maybe they'd want to come in for an immune boost treatment to really try to maximize their overall immune function and prevent the possibility of getting sick. When you mentioned NAD, that's probably a much longer discussion for a different day. But generally speaking, NAD is a precursor in raw natural energy production. So, if we think back to high school biology, which I won't get too involved in, but glycolysis, electron transport chains, citric acid cycle, this is all about anaerobic versus aerobic respiration and producing ATP is ultimately what all those pathways are all about, which is you hear about mitochondria being the powerhouse of the cell. Well, NAD is a precursor to the production of ATP. So all of our cells in our body need NAD to function. As we get older and depending on underlying disease, autoimmune disease, stress, our levels decline. Some people more so than others, depending on their lifestyle, and it's hard to get enough into the system, especially by oral means, which is why intravenous NAD can be so effective at maximizing those levels, and really makes a tangible difference in a lot of people that we've had as patients over the years, noticing a major change in just overall function, whether that's focus, mood, sleep, energy. We've had a whole slew of people have come through with chronic brain fog, chronic fatigue, post-COVID syndrome, who just can't really get back to their regular state. And they've seen multiple specialists and in and out of various doctors' offices and aren't getting really the help or the answers they need. And they're saying, you know what, why don't I just give this NAD stuff a try? And after one treatment, multiple people have said, you guys have actually made me feel like myself for the first time in 20 years, and little did they know that they had profound deficiencies in NAD that were contributing to this kind of new normal for them, which they didn't even realize they could feel as good as they could. And we're very grateful to discover these treatments that we offer.
And I think it's a perfect segue into sort of the evolution of Onus now going into sort of, I guess, the longevity, more preventive, and into the hormonal therapy. It's, you said something to me a long time ago about a lot of people are walking around and just don't know where they're at in terms of their either the testosterone or even vitamin deficiencies. You just sort of, you learn to live as you are, and you don't know where you're at. Can you just sort of share, as you go from IV to these other sort of suite of services, where the why, I guess, and also, why do you view these as an important add-on to go with the IV, and how they sort of commingle, or how they can complement each other?
Yeah, so as of the last year or so, we've added on some other complementary services to just the IV infusions, right? So we offer a whole slew of vitamin cocktails and NAD, which definitely help people feel better, right? But there was more to it, and I think there's a lot of complementary services to those IV infusions that could really help people maximize their overall health. And one of those is BHRT, or biologic hormone replacement. I think there's a lot of people that don't know how good they could feel with hormonal supplementation. And to your point, just accept that as the norm. And oftentimes, folks can be deficient in testosterone, usually starting in middle age, whether it's 30s, 40s, 50s, and don't realize that there are these supplements that can be given either via injection, but in our case, usually mostly via pellet insertion under the skin surface, which slowly absorbs over the course of 3 to 6 months, depending on the individual and whether they're male or female. But estrogen supplementation and testosterone supplementation specifically. And people start realizing, again, it's focus, it's mood, it's energy levels. They're not having as much weight gain. They're sleeping better. Their libido is enhanced. I mean, there's so many positive effects that they didn't realize that they could feel that good. And so here we are already offering these other services. Well, why not add in these other treatment options, specifically in the realm of hormone therapy, which can, make folks feel even better. And with that brings the advent of lab testing, because with hormone therapy, it is important to do serial labs and obviously checking levels, but also making sure blood counts are stable. And so with the advent of labs, we are now able to tailor vitamin treatments as a result. So we can basically now assess certain vitamin deficiencies that may have not been detected before. Because in the early days, we weren't doing any of that. But for instance, if someone's deficient in B12 or vitamin D, now we know and can specifically tailor an approach to target those deficiencies. The realm of peptides is a really interesting one. The concept of a peptide is basically a string of amino acids that is often a precursor for protein synthesis. And there's thousands of them out there. And we've just slowly starting to roll out our peptide program, but for a variety of indications. So for instance, common one is one that's called BPC 157. They all have very interesting names that are often very scientific. But this is biological protection compound is actually where the BPC comes from. And it basically is a very strong anti-inflammatory, antioxidative agent, but has also been proven to increase the production of fibroblasts, which are really important in collagen production, as well as a process called angiogenesis, which basically means increasing circulation and formation of new blood vessels. So in the setting of healing, whether it's a tendonitis or a sprained knee or some kind of cartilage defect, whether it's a meniscal tear or something to that effect, this compound has been amazing in its ability to enhance healing with certain types of injuries. Really cool stuff. And that's just one. I mean, there's a lot of them out there, but this is another approach that's often administered subcutaneously in the form of an insulin syringe kind of thing, that can be added on to these other services that we're basically, already offering at baseline.
And these are really for, anyone, but man, I look at this and go, if you want to be preventative versus reactive in your health, I mean, I think it behooves you to at least, for me, the first time we talked, you mentioned some of the things that the doing the hormonal supplementation, all these things with the benefits. And I was like, I suffer from that I feel like I'm tired this. And I think we talked, I'm a consumer now, and there's been palpable changes in sort of my sleep, my energy, and all these other things. And it's been, I'm happy I did that. And I'll be honest, I don't like going to a doctor, and we have a local one out here. We don't have an Onus out here in Phoenix, but going to one, and the process was so easy. And to find out where I was deficient, even in vitamins, where I was already supplementing vitamin D, but I wasn't doing it right. I wasn't taking, I think it's DHA or essentially omega. You know better than I do it, but I wasn't doing it the right way for my body to properly absorb it. And to learn that was just a big deal for me. And I just feel like there's a swell of people are looking at the sort of the healthcare system and going, I think I can get ahead of this and not have to be sort of into that churn that you can get into there. I guess, what do you guys, I know it's fairly recent for you. How do you feel it's going so far? And yeah, obviously it opens up just a suite of things you guys could potentially do down the road, but how are things going so far?
Well, it's great. It's been a significant learning process for me. And so to your point, my training is based in conventional Western medicine, which largely is a reactive process. In other words, there's a problem medically, that some form of disease or medical issue, and then, okay, we have this whole, variety of approaches at treating it. Right? Someone's got strep throat and put them on some antibiotics. Well, there's a shift, I think, as far as my involvement here with Onus, that has put me in a situation to really emphasize prevention and a proactive approach to health that basically says, well, if we can prevent strep throat from occurring by boosting immune system, it seems to make sense to do that, right? And I think there are obvious indications for both. And so here I find myself somewhat straddling the tracks with one foot on one side and 1 foot on the other. And they don't have to be mutually exclusive. My whole goal in this process is really trying to bridge the gap, because I do find that people tend to align with the different camps, right? People who firmly believe in purely Western conventional medicine often look at this alternative approach to things as smoke and mirrors, right? And vice versa. That's the same could be said for the counterpart. People who believe in more of the natural, holistic approach really despise conventional Western medicine. I don't think it needs to be that way at all. I think there are obvious indications to both, but it seems to make common sense to me that why not implement a more proactive approach to health and wellness to prevent the formation of disease? And I think this really comes down to this concept of longevity for us. And this has been kind of that evolution for us, is this whole concept of living better longer, right? It's not the quantity of years that's truly important, but it's the quality of those years. I see this in the ER all the time, where patients come in and they're coming from nursing homes and they're alive, right? They're living, but they are not aware or really have much in the realm of quality of life, right? So why not do everything in our power to extend the quality of the years that we have left? It doesn't make a whole lot of sense to me to live to 100 years old if the last 20 years of your life are spent in a nursing home, in a wheelchair, unable to provide for yourself, can't clean and bathe yourself, can't do the things that you would otherwise love to do. Why not spend those last 20 years still being able to do those things? And I think that whole concept of longevity encompasses all of that.
Yeah, I think there's just more awareness than ever. I see. I just you can see it out there in the general public now too. You mentioned earlier the sort of what your J job, what you do now, and how you're able to work less, and it's a very stressful environment. You all, Onus is part of what you guys do is hire ER nurses, and take me into sort of the why and how easy is it to find these folks, and how long do they stick around, and the big benefit of having an ER nurse sort of administer the IVs and be part of the whole process.
Yeah. So as far as nurses in general, and respect to all people who choose nursing as a field, because it's, I think, a largely underappreciated field as far as how hard they work. But the rock stars, in my opinion, generally speaking, are the nurses in the ER. Their skill set is one that sees everything under the sun. And especially when you're talking about starting an IV, you don't want anybody else other than an ER nurse doing that, because they do it all the time. They're also able to manage a high volume, high stress atmosphere with ease. That's part and parcel of their work. And so when it comes to Onus IV, that was one of our requirements, is really only having ER nurses with a minimum of 2 years of experience, basically working at Onus, because they're familiar with high volume and kind of high stress environments. And this actually provides a much more stress-free environment for them, which gives them kind of a nice balance compared to their regular day-to-day routine in the ER. But they're also able to recognize if someone is potentially too sick for an elective IV infusion, for instance, right? And they can refer them to the respective hospital environments if need be. But that's who you want taking care of you, because they have a skill set and a knowledge set that is vast. So that's one of the things that sets us apart, is we really only hire ER or ICU level nurses who have a huge knowledge base, but are also rock stars when it comes to starting IVs and can handle high volume, managing multiple people at once for those busy days that we sometimes have. And yeah, as far as turnover, we really don't have any, because once a nurse starts working at Onus, they just love that work environment. It's pretty laid back. You're getting to hang out with your customer base, usually sitting in a chair for 30 minutes to an hour. We have a whole bunch of members that come in on a regular basis. So they establish this regular relationship with that nurse, and will only show up to an Onus when that nurse is working. So they really do establish kind of like this regular connection and relationship. And if some of our nurses are full-time at Onus now, I mean, they have left the emergency room entirely because they love what they're doing at Onus more. It's pretty stress-free overall. So when it comes to turnover, it's very limited, if any. We also get applications on a daily basis for nurses who want to work for us. So I think finding nurses is probably not really an issue, because this is I think nurses are aware that this industry exists and that it's a nice balance point to their regular work as, working in the ER. You definitely don't need any medical background to start Onus IV, for instance. We are giving you the keys to the castle and showing you how this is run, and we're going to be influential in finding you the staff that you would need, whether it's a medical director in another state or nursing staff to basically be present for their shifts. Yeah, it's never been an issue. If anything, it's unfortunately turning folks away because we're fully staffed as it is. So
Yeah, I wanted to touch on that. Obviously, we're having this conversation because Onus is growing, and we're looking for potential folks to become franchisees outside the Denver area. And I don't have no medical background. It'd be intimidating for me looking at this, going, "Geez, I don't know much about this." And you mentioned you don't need that. You guys are going to help find that medical director. There's a slew of ER nurses probably in every city looking for either something else to supplement or to get out, or to find something to be a lower stress environment. What what would you say to anybody like that's looking and going, "Hey, I like this idea of longevity and helping people, enhance their health, their lifestyle, but man, I don't know. I'm not a doctor. How do it's like, and I'm intimidated." What did you say? I mean, you're obviously living and breathing it. What would you say to somebody that's looking at Onus?
yeah, I mean, I think for a potential investor out there, I think the most important quality would be someone who's interested in this concept of longevity and enhancing the quality of their own life and wanting to share that, realizing that there is a industry that's very much in its infancy currently, that will be booming over the next 5, 10+ years. They're going to learn a lot, especially if they don't have much in the way of medical background. But do you need a medical background in order to understand these concepts? Absolutely not. I think it's really just an issue of wanting to take the initiative to head down this path of, overall wellness and longevity. And we have lots of teaching aids and tools along the way to help people understand this better. If they really just want to be involved kind of in a more of a managerial role and allow and defer to some of those more medical things to the med director and nursing staff, I mean, I think that's fair as well. But I think first and foremost would just be an interest in this field, generally speaking.
And then, I mean, to me, it's like, what a great time, because you mentioned there's going to be, this is the early stages of this sort of the longevity. And then you guys have your first franchise location. So there's going to be tons of learnings from that too, where, hey, as you just get better, as you go through. I think this is a great time for anybody, looking to get into this space. And obviously between you, Christy, and Chaz, there's, unbelievable support. And you guys have 6 of them, been operating for 10 years. So there's a wealth of knowledge and how to make sure everything's done the right way. On my end, is there anything else you want to touch on with Onus or the longevity piece?
Well, I think I like this concept of, you mentioned this evolution of Onus, and is continuing to evolve. And I like that concept of not being stagnant. You look at the IV industry as a whole, and it very much is saturated, I think, to some extent, because people are just doing IVs, but they're not looking at the bigger picture. And there's so much more that can be offered. We are slowly rolling out these new additional services, including BHRT, peptides, which is a whole separate world of therapy. But when you look at the alternative healthcare as a whole, there's things like hyperbaric oxygen, there's ozone therapy, there's a whole variety of things that can be added on, that as we continue to grow and evolve, we may bring in these other services that really complement the base service of where we started, which is IV hydration. But that's just, I think, scratching the surface. So I love this idea of it being a dynamic process, that one is continuing to evolve, continuing to learn. And as things come out and more of this research is ongoing in the realm of longevity, we're there to adapt that, as whatever the future holds in that regard.
And one thing before we end this, that I think, I'm not an expert in the IV world, but Onus does something different than any other one that I've seen. One, it's obviously the ER nurse, and I think there's a level of expertise you're getting with that. But two, going into these facilities sometimes can be intimidating. because you don't know and you're asking questions. The feel of an onus is anything but intimidating. When you go in, it doesn't feel clinical, but it has very skilled professionals. You guys are doing things the right way. You've even, you'll turn someone away if you don't feel it's right, and you make it relaxing where anybody can go in, feel comfortable, ask questions. You're talking to an expert in an onus, and it's in a setting that makes you feel like you're not about to have the lab light over you, and you're in this white sort of sterile area. Although everything's done at a very, I mean, you guys mixed IV bags in front of people. I mean, it could be more transparent and more, medically, I guess, I don't know the right word for it is, but you guys do everything the right way, probably above and beyond than you have to on a lot of ways.
Yeah, we run a really tight ship. We have an amazing, incredibly knowledgeable staff. But to your point, we really don't want to create an environment that feels like a hospital. We want to create an environment that is welcoming, is warm, is comfortable, but you're still going to have the knowledge base from our staff that is what you would expect from any other type of medical environment. It's just in a much more comfortable setting. So I encourage people who are looking at potentially getting involved in this IV space to do some shopping, and you'll see a lot of these, our competitors and other services that are out there often do feel hospital. It's these fluorescent light bulbs and very sterile kind of feel. Not to say sterile is a bad thing, because we're very sterile as well, but that's the feel we're trying to get away from. We want to make it a comfortable and an inviting experience that people are going to continue to seek out, because there is that whole phobia of needles, and we do our damnedest to try to, circumvent that the best we can. There's no way of getting around the needle into a vein, but I think when you compare our overall environment compared to the other ones that are out there, it's night and day.
Yeah, I couldn't agree more. I mean, I've been a customer, and the process was so smooth. I didn't know she injected me or put the needle in.
I love it.
And I didn't realize that it was done. It would happen. Everything was as good as you can get. So, but thanks again, Ben. It's an education. Every time I talk to you, I feel like I'm learning something. So I always enjoy it because it's just always these little nuggets I pick up. But I know you're busy between Onus and traveling, being an ER doctor. You have a lot going on. So I appreciate the time, and look forward to seeing you guys continue the growth.
Sounds great. It's been my pleasure. Look forward to chatting with you soon.
All right. Thanks, Ben.
See you, Nate.
Okay.